Hello, and welcome to my webinar on Tourette syndrome. The condition is named after the French physician who studied it in the late 1800s. His name was Gilles de Tourette. The syndrome was once believed to be a psychiatric disorder due to its accompanying behavior problems. The more modern classification of Tourette's is that it is now considered a neurological disorder that begins in childhood and oftentimes starts to decline during late adolescence. Let's take a look at a Prezi presentation to help you better understand this syndrome. A Lesson on Tourette Syndrome by me, Daniel Gargiulo. So what is Tourette syndrome? Tourette syndrome is a neuropsychiatric disorder characterized by motor, which are considered physical movements, and phonic, which are considered sounds produced from the mouth, tics. Tourette's affects an estimated 3 to 8 school-age children out of every 1,000. In America, there is a lower frequency of Tourette syndrome between Hispanics and African Americans. This may be attributed to differences in access to care, meaning it goes undiagnosed. Associated problems such as attention deficit hyperactivity disorder and obsessive compulsive disorders can often be more disabling than the tics themselves. Tourette's is one of 4 neurodevelopmental disorders that is classified as a tic disorder. The other 3 are persistent motor tic disorder, persistent vocal tic disorder, and provisional tic disorder. This word tic keeps coming up, so let's take a closer look. What is a tic? A tic is a sudden, rapid, recurrent, non-rhythmic motor movement or vocalization. Tics are stereotyped as movements or vocal sounds which are jerky or dystonic. They are the clinical phenomenon that forms the core of Tourette syndrome. Although tics are common in children, only about 1% of those affected meet the criteria for Tourette syndrome, and many are not disabled by it. There are both voluntary and involuntary tics associated with Tourette syndrome. Just before the tics, there is often a premonitory sensation, an itchy, tense, or tight feeling around the area of the tic, or a mental feeling, internal tension, a desire to tic only relieved by performing the tic. In this image, you can see the parts of the body that people with Tourette syndrome most commonly feel the urge to tic, or have involuntary physical tics. It has been described as an itch or pain that you feel you have to scratch. Performing the tic may relieve this itch or pain for a temporary period of time. Diagnosing Tourette's. According to the Diagnostic and Statistical Manual of Mental Disorders, the 4 criteria that must be met for a Tourette's diagnosis are multiple motor and 1 or more vocal tics have been present at some time during the illness, although not necessarily concurrently. The tics may wax and wane in frequency, but have persisted for more than 1 year since first onset. Onset is before the age of 18 years. The disturbance is not attributable to the physiological effects of a substance, such as cocaine, or another medical condition, such as Huntington's disease. Tourette's by itself is not considered a learning disability, and it does not affect IQ. However, a high percentage of people with Tourette's also have a learning disability. The Tourette Syndrome International Consortium Database, also known as TIC, found that out of 5,450 subjects with Tourette's, 1,235 had a learning disability, which comes to about 23%. Outside of the tics, the main issue arises because there is a very high percentage of people with Tourette's that have co-diagnosis with other disorders. The most common diagnoses associated with Tourette's are ADHD and OCD, but also include depression, personality disorders, anxiety, and more. Treatment. The cause of Tourette's is unknown, but there are strong genetic factors. Treatments should be aimed at minimizing disability and include social, psychological, and biological approaches. Management should be holistic and factor in the quality of life of the patient and family. Tics do not kill people, and the syndrome is not degenerative. That said, pharmaceutical treatments have been shown to reduce the amount of tics prevalent in patients. Parents, doctor, and the patient itself must find a balance between minimizing the side effects of the drug being taken in a way that maximizes its beneficial effects. All cases are different, and patients with milder form of Tourette's may not find taking a drug to alleviate symptoms is worth it. Education of the patient and family about the disorder is important, including genetic counseling when it is appropriate. Educating the patient's schools is important because teachers should be aware of how to best deal with the situation as well as help monitor progress. Psychotherapy has been found to help those with Tourette's cope with the symptoms, personality, and behavioral tendencies, but is not recommended as a primary treatment. School life. Because Tourette's itself is not a learning disability, the most common issue students with Tourette's face is in their social interactions with their peers and teacher. Research shows that teacher and peer education about Tourette's is the best way to combat the negative prejudices associated with the syndrome. Tics peak for those with Tourette's around the elementary age. They are also worsened by anxiety, excitement, or exhaustion. So the students may have less tics when engaged with schoolwork or some sort of task, but recess, after-school sports, quizzes and tests, or any other kind of exciting or stressful activity can trigger an increase of tics. It is important for the teacher and students to be aware of this. Keeping an eye out on bullying is also important. When peers are not educated on the disease, they may think that the person suffering with it is, quote, making it up for attention, or even that the tics are contagious, which are both not true. Support from both teacher and peer can reduce the thoughts of self-consciousness and social isolation and physical pain associated with Tourette syndrome, and lead to a happy school life for those suffering. Here are some tips for teachers from the Jim Eisenreich Foundation for Children with Tourette syndrome. It is important for teachers to be aware of the student's diagnosis and related disorders and how to deal with them. It is important to set a tone in the classroom of respect for everyone. Never embarrass a student because of his tics or ask him or her to stop their tics. Discuss Tourette's with the student's classmates. If possible, do not set up the student's desk in an area where another student will be looking directly at him or her. Small groupings between 3 to 6 students seem to work best. Lectures can trigger tics because the student becomes aware that the tic is disrupting the class. Hands-on activities, learning centers, and workstations help to alleviate this. Adhering to a consistent schedule that is in an accessible place for the student to refer to helps with the stress of the school day. Contact the student's previous teachers to find out what has worked for them in the past. Provide headphones or allow the student to bring in headphones to wear while they are working alone on assignments or reading silently. Provide hope to the student's parents. Parents of children with Tourette syndrome need to hear frequently from their child's teachers. Keep them informed about every area of their child's development. Life at home. The home life of a child with Tourette syndrome is tied to the atmosphere of the home as well as the support system provided by the child's family. A low-stress at-home environment with understanding parents can cause a decrease in tics. On the other hand, if the parents do not take the time to understand Tourette syndrome and the at-home life is stressful, this can lead to an increase in the amount of tics, emotional, and even physical pain. It is important to note that even if the home is relatively stress-free, if the child does not focus on some sort of task, tics may increase. This can be confusing because the atmosphere seems to be very relaxed. It is recommended that you do activities with your child if they have Tourette syndrome. Career and life after school. Although the onset of tics is typically between the ages of 4 and 6, peak severity occurs between the ages of 10 and 12, there is good news. There is usually a decline in severity of tics during adolescence. Most adults with tic disorders experience diminished symptoms, and only a small percentage of adults will continue to have severe or worsening symptoms. So many of those with Tourette syndromes are able to lead healthy, normal working lives. The prevalence of diagnosis of other disorders is something that must still be monitored throughout adulthood. That said, all cases are different, and if an adult does still have severe tic symptoms, their career choices will become limited. Operating any kind of heavy machinery can be dangerous if motor tics are not able to be controlled. It is important to make coworkers aware of your disorder, because people can take tics the wrong way if they do not know the reason behind them. Let's take a look at a 1-minute long video clip that will show you what Tourette's is like from the child's perspective. This clip is from the documentary I Have Tourette's, but Tourette's Doesn't Have Me.
It feels weird, because I'm in control of everything else. Why aren't I in control of that? Why can't I stop myself from doing that?
Like I have to go. Like that every single second.
I just feel like kind of funny inside. I say like, why can't I stop doing this? Why can't I stop doing this?
I had a tic, like a really loud screeching noise. All the kids would like tell me to stop and just keep staring at me. Stop it, and I would say, I can't.
Certain things trigger tics, and like, let's say reading letters, I guess. Like, every time you come to the letter P, you'd have to jump, like, on one foot, like that.
I'm doing it so much that it drains my energy, and I can't handle it, and I just get tired. It's also embarrassing.
You feel like a marked man, you know? Like people would already know you when they don't.
The hardest thing is probably you can't make friends as easily as someone else who doesn't have Tourette's. People stare. But you know what? You gotta just, like, let them stare.
Thank you for taking the time to watch my Prezi on Tourette syndrome. In conclusion, it is clear that Tourette syndrome comes in all shapes and sizes depending on the severity of his or her tics. It is important to find out if the child with Tourette's has any accompanying co-diagnosis. It is clear that if the child's family, teachers, and peers provide a good support system by taking the time to understand the syndrome, the child with Tourette's has a chance to live a happy life. Awareness and education is the key. If you have any questions, please post them on my discussion board posting. Thank you for watching.